Well, we want to stick with this conversation. For that, we want to bring in Dr. Brian Garibaldi. He's the medical director of the Johns Hopkins Biocontainment Unit. And Dr. Garibaldi, great to have you back on the program. Let's just start with some of those numbers that we were laying out at the top of the show here. We're approaching 200,000. We're approaching the average of 200,000 new cases a day. These numbers are extremely alarming when you take into account just the trajectory of the virus and the spread that we're seeing at this point. What's your sense just of where we are in the outbreak, and what are you urging Americans to do right now?
Well, we're really concerned. We haven't seen the extent of spread that's going to happen after the Thanksgiving holidays, and we're already hearing about many health systems that are reaching capacity in terms of ICU beds in particular. So I think things are going to get worse before they get better, and we're all hopeful about what the vaccine brings for the spring and into next summer. But I think right now we're dealing with some serious issues related to the number of cases and the number of hospitalizations and likely deaths to follow.
Doctor, when you talk about things getting worse, I know here in New York City, they've talked about adding 25% bed capacity. They could have ordered 50, but the governor right now is just saying 25%. But in other parts of the country, they've already reached capacity, or is there still room for those who need a bed in the hospital?
Well, it's not just the physical beds, it's also the staff members to be able to staff those beds. So I think we are getting to certain areas in the country where you're going to start hearing more and more about implementing crisis standards of care, which may mean, either rationing certain resources or accepting that we're not able to provide the same level of care that we would normally provide if the hospitals weren't above capacity.
Doctor, we also heard Governor Cuomo saying that he could shut down indoor dining in the city if the hospitalization numbers don't start to stabilize. I'm just curious, just from your point of view, your personal feeling about this, what you've talked to your colleagues about. Would you eat inside of a restaurant right now?
No, I can't. I think the last time I ate inside a restaurant was in March. I think we know that eating inside when people are laughing and taking off their masks, that you don't know what the ventilation is going to be like in a given area. I think we know it's one of the higher risk things that we can engage in. And when the virus is spreading this rampantly, I think people need to really reconsider whether or not they want to dine in right now. And there are other ways to support the restaurants that you know and love, but it's a pretty high risk activity.
Dr. Garibaldi, nobody wishes illness on anybody. But what do you think when you see someone as prominent as Rudy Giuliani traveling the country without a mask, high-fiving people last Thursday at the State House in Arizona, now testing positive for coronavirus? What goes through your mind when you see this repeatedly happening?
Well, we've been talking about this amongst ourselves, amongst colleagues, and it's frustrating to see that we haven't learned our lessons by and large. We know how this virus spreads now. We understand the extent of risk, and we really haven't been able to come together as a nation to say, we need to behave in a certain way to try to protect ourselves and as importantly, protect each other. So it's frustrating to see how things have really gotten out of control over the last several months.
We had some news out this morning just in terms of President-elect Joe Biden. He named some key members to his health team. California Attorney General Javier Becerra, he was named to head HHS. We also have Dr. Rochelle Walensky, taking the lead of the CDC under the Biden administration. What's your assessment of his picks, and what do you think needs to be on the number one thing, the top priority on their agenda right now?
Well, I think we're all really excited about a renewed emphasis on following the data and following the science. And I think by and large, all the picks that Dr. Biden has, that President-elect Biden has come out with are really qualified and have done a lot of work already on the COVID-19 response. So I think that's very encouraging. I think what we really need to focus on right now is the vaccine. We need to make sure that the process for approval through the FDA is transparent. We need to make sure that we're upfront and honest with the public about why they should be vaccinated. We need to be transparent about the potential side effects, and we need to have the data out there so that people can be confident that they should go ahead and get vaccinated when the vaccines become more widely available.
How do you get through the day? You mentioned the shortage of people needed to care for those who are ill. How do you personally do it?
Well, I think I personally derive a lot of satisfaction from being able to participate. And, we have such an amazing team here at Johns Hopkins, being able to participate in the care of patients. I do a lot of research on trying to understand outcomes in COVID to try to help our frontline providers to do a better job taking care of the patients. And at the end of the day, I do rely a lot on my family and the ability to spend time with them, and I play a lot of guitar too. That's really what gets me through.
Well, Dr. Brian Garibaldi, we really appreciate all the work you and your team are doing. We wish you all the best. Thank you so much for taking the time, and we hope to have you back on the program once again soon.
Thanks so much. Everyone stay safe, please.